Diabetes is a worldwide problem that can lead to devastating consequences. Diabetes kills more people than cancer and HIV together. Yet, very few people are aware about the nature of this chronic condition. The Latino population, the largest minority group in the country, is at a particularly high risk of developing type 2 diabetes, the most common type of the disease. In addition, this group has a high chance of developing its chronic complications and receive a low quality of diabetes care. Furthermore, Latino children and adolescents are now developing type 2 diabetes, a disease that used to appear only in older adults. According to some recent data from the Centers for Disease Control, 50% of all Latino children born in the U.S. on or after the year 2000 will develop type 2 diabetes in their lifetime.
Yo les recomiendo a toda persona, por lo menos primero, hacerse su chequeo médico, su glucosa, porque esa es una enfermedad demasiado peligrosa. Yo me atrevo a pensar que esa sería la enfermedad del siglo.
This high risk is related to a strong genetic predisposition for type 2 diabetes, along with clear lifestyle factors, such as inadequate meal plan and lack of physical activity with consequent high rates of overweight or obesity. The Latino Diabetes Initiative at the Joslin Diabetes Center was developed in 2002 to tackle these enormous challenges. The Joslin Diabetes Center, the most renowned institution dedicated to diabetes in the world and affiliated with Harvard Medical School, has been the perfect setting to embrace such an ambitious initiative. The Latino Diabetes Initiative has had the mission of improving the lives of patients and families with diabetes or at risk for the disease by developing and implementing culturally oriented activities in the area of diabetes care, education, outreach, research, and professional education. Our bicultural and bilingual team provides the highest level of diabetes care in a culturally and linguistically oriented manner.
Uno siempre necesita una guía, alguien que lo cure, alguien que le diga, alguien que le indique qué hay que hacer. Uno necesita una ayuda para poder mejorarse.
We found great benefits in group activities, such as shared medical appointments, classes, support groups, supermarket tours, and even a salsa dancing program. Our patient education material, such as Rosa's story, is a clear illustration of how science, technology, and culture can come together to help many families in a fun and practical way.
I think Joslin Clinic is doing a phenomenal job with not only the English-speaking population, but with the Latinos. Latinos have their own culture about food, about exercise, and without education, a diabetic cannot survive too long. And education is the key word in what Joslin is doing, because diabetes is very high within the Latino community, is trying to address an issue that has been ongoing for quite some time. And it's a wonderful place to be.
Our research endeavors have focused on identifying factors that influence the development and course of type 2 diabetes in the Latino population. Our outreach activities have been developed to raise awareness about the high prevalence and potentially ominous consequences of diabetes in this group. We have participated in multiple health fairs, screening and awareness campaigns, and community-based education programs through the press, radio, television, and the internet. We have developed and implemented continuing education programs for healthcare professionals at a national and international level, expanding the benefits to patients and families throughout Latin America and Spain. We are particularly proud of the JVN Venezuela Project, a one-of-a-kind telemedicine program implemented in collaboration and under the guidance of Dr. Lloyd M. Aiello in the Beetham Eye Institute at the Joslin Diabetes Center and supported by the MMG Foundation. This project has pioneered the implementation of a remote system to evaluate the presence of eye disease in children with type 1 diabetes at the JM de los Rios Public Hospital in Caracas, Venezuela. High-quality retinal images are transmitted from that hospital to the reading center at the Joslin. A formal evaluation and treatment plan is then integrated and reported back to the hospital, along with a comprehensive education program developed by the Latino Diabetes Initiative team to help these children and their families. We are very proud of these accomplishments. But we know this is not enough. You can help us. You are and can continue to be part of the important mission of helping high-risk populations. Spread the word. Provide your support. We are confident that we can beat diabetes. We want a world free of the disease and a better life for those with diabetes or at risk. We have hope that life can be better for many patients and their families. We have hope that together we can continue to make a difference. We have hope that we can face the challenge of diabetes and win this battle. Thank you all for coming to Ritmos de Salud. Muchas gracias.